Hi, my name is Chris Hourigan. I'm from the National Heart, Lung and Blood Institute in Bethesda, Maryland. I was here at EHA today to talk about measurable residual disease in acute myeloid leukemia. So we're really at an exciting time with MRD in AML. Measuring residual leukemia has been really critical for CML and ALL, and we really think we're getting towards the point now where we can actually start integrating measurements of residual disease in AML care to make better decisions in AML. There's two things that have really happened over the past 2 years. One thing was the response criteria for AML was updated by the European Leukemia Network to include a category of CR in the absence of MRD. So this was important. This is a higher stringency response criteria. And then just very recently, in the last few months, ELN has released consensus criteria on the way we should measure MRD in AML. And so I really think this is historic that we're making the first steps to really harmonizing the way we measure MRD in AML. And I think there's multiple implications from this. I think one thing is it's opened up the conversation between pathologists, between physicians, between industry, and between regulatory experts to really think about how we can move this out of local practice into something that can be used nationally and internationally to improve clinical care, to benefit the drug approvals process, but also importantly, I think, to predict early relapse. We think this has got immediate applicability in the clinical care of AML patients. What my talk was focused on was the new updated consensus criteria on how we should measure AML, and this is just a first step. And then I really spoke about the use of next generation sequencing, which has the potential to revolutionize measurable residual disease testing in AML, but there's some important caveats and standardization we need to do first. And so we really went over some of the work we're going to have to do over the next 2 years to really bring this into something that physicians can use throughout the world in a highly harmonized, standardized way where we know the significance of the test we're measuring.